Good morning. Thank you for joining us. My name is Cindy Holzheimer, and I am the President and CEO of the Northern Ohio Area Chambers of Commerce. We are an association of 125 chambers across Northern Ohio, and one of the largest chamber associations in the country. Though we are not celebrating our 25th anniversary this year, how we had in mind, we continue to offer high-quality cost savings benefits that chambers can provide to their members as part of their membership packages. Chambers across the country have been working tirelessly the last few weeks and months, surveying their members, asking what their current conditions are, if they are open, when will they be opening, how are they doing business online, and what resources they need to help them stay in business. From day one, our local chambers have been an invaluable community resource in providing trusted, up-to-date information that businesses have needed on anything from how to trim costs to applying to disaster relief funds. Over the weekend, I finally had some time to reflect on just how much all of our lives have changed during the last few months. I remember on Wednesday, March 11th, my husband and I were setting up our NOAC-sponsored booth at the piston-powered On-Rama at the IX Center. I was so excited to show off our new signage and table that I had just picked up the day before. Early in the morning, we got a call from the IX Center saying that we needed to come and take everything down and take it back home again, as the event had been canceled. Over the next 10 days, things became very surreal. We could not go to the movies, go to a playground, see any sports in person, or gather in groups larger than 10. We saw the election date moved, and then to a mail-in vote. Children switched to online learning from home, and non-essential businesses had to close. And then we were instructed to stay home to stop the spread of the illness that we couldn't see up until then, and most had associated as something happening in China, not in the United States. We learned the term social distancing, which I believe was just called being an introvert before then, and then the term flatten the curve. Before now, not too many people had ever heard of Zoom, and now we all seem to be experts. We all hop on a call, put ourselves on mute, turn our virtual backgrounds on, and away we go. Each day seems to bring a new challenge as we find ways to adapt and make the best of each situation as they come up. We are seeing birthday parades, drive-in graduation ceremonies, and even virtual weddings. Just really some great ways to be apart together. So many Ohioans, though, are reeling from losing their jobs and are experiencing long wait times to be approved for financial assistance. Business owners and nonprofits alike have really struggled with having to reduce their workforce, adapt to a new business model, and wade through the ever-changing world of grants and loan funding. Fast forward through the 427 days of April till now, and we are all ready for whatever the next phase will be. We're just really tired of being cooped up. We're ready to go back to work, go to the gym, go down the aisle at the grocery store and see more than 5 packages of toilet paper or beef or eggs. I think most of all, we're longing for the days that we can hug our family and friends again that don't live with us. As a result of our governor's aggressive plans being put into place early in March, Ohioans were really able to flatten that curve in this pandemic, which has allowed our healthcare professionals to build our hospital systems up in event of a surge. Now that testing capabilities are improving, PPE and cleaning supplies are becoming more available, and the number of new cases per day are slowing. The governor, lieutenant governor, and Dr. Atkin have initiated the Responsible Restart Ohio phased approach to getting the economy rolling again. As of May 1st, medical providers, including dentists and veterinarians, resumed non-essential surgeries and procedures, following proper protocols, including but not limited to patient testing and no overnight stays. On May 4th, brought manufacturing, distribution, and construction businesses back to work that were not permitted to stay open in April, also following a few protocols. Employers were encouraged to change shift patterns and stagger lunch and break times to ensure distancing. They also needed to space factory floors in order to allow distancing and using barriers if need be. General office environments were also permitted to return on May 4th. These businesses are still encouraged to have as many employees work from home as much as possible. I have had a chance to consult with several HR professionals over the past few weeks, and they offered a few words of advice. If you are an employer, make sure your HR policies are updated to include sick leave, paid vacation, personal time, things of those natures. You can reference the Families First Coronavirus Act for more details on those qualifications. In order to qualify for the Paycheck Protection Program forgiveness portion, if you receive this loan, you must restore your staffing levels to that part in your loan by June 30th. This level does not have to be filled with the employees that did leave. When you contact an employee and let them know that you have a work available for them and that they can return to work, and they say no, ask a few very important questions. Do they have a disability that may cover them under the Americans with Disabilities Act? Do they have a serious health condition, non-COVID related, that may be covered by the traditional Family Medical Leave Act? Are they caring for a child at home because of daycare closures? Are they caring for an ill family member? Do they live with an at-risk individual and are afraid of themselves becoming a carrier? Are there any safety concerns or possible violations in the workplace that may make them uncomfortable to return? Never assume the answer to the questions. Be very specific and ask them why they're not returning. If you can determine that there are no protections for that employer under existing law or employee, and the employee is still refusing to return to work when you have let them know that work is available, you do have grounds to discharge them at that time and move forward with hiring new employees. For more specific information regarding returning to work, consult with an HR specialist and legal counsel if you don't have one on staff. Another piece of advice, having a designated COVID HR person in your workplace is very helpful for your employees, as that is that person who is designated for them to go to if they have any questions regarding their employee. If you have an employee or a customer who tests positive for COVID-19, immediately report the infection of that employee or customer to the local health district. The patient's healthcare provider will do the same, but as an employer, it is a good thing to do. Work with the local health department to identify potentially exposed individuals to help facilitate appropriate communication and therefore that important contact tracing that needs to happen. Shut down your shop or floor for deep sanitation and hire a professional to do that. Reopen in consultation with your local health department. On Tuesday this week, we saw consumer and retail services reopening their doors. A few things business owners need to make sure they do. The capacity at stores needs to remain at 50% of the allotted fire code. Merchandise must be cleaned before putting on the shelves if possible. Customers may notice a few things as well. Hours established for the elderly or at-risk population, and checkout areas may have a barrier between you and the cashier. Malls have also reopened, with food courts remaining closed and seating areas removed or blocked off. Not all stores and malls have reopened, so don't be surprised if you see that when you go. Some malls have a store that is not yet permitted to open, or maybe the store doesn't have enough returning employees yet to open their doors. Starting tomorrow, May 15th, personal care services will reopen. This includes hair salons, day spas, nail salons, barbershops, tanning salons, tattoo and body piercing services. Also, massage therapy, acupuncture, and cosmetic therapy facilities that are licensed by the State of Ohio Medical Board may be permitted to reopen. You will see your stylist wearing gloves and a mask during your visit. Some may be wearing total eye or face protection based on the proximity they are to their customer. Extensive cleaning must be done between customers, and any single-use materials that were used during your visit must be discarded. Social distancing at these facilities does apply, and it is understood that the distance between a client and employee may be less than 6 feet, especially if they're cutting your hair. Customers are encouraged to wear masks when appropriate. Also happening tomorrow will be the ability to eat at your favorite restaurant or bar, provided they have outdoor dining. You may see your wait staff wearing masks and signs posting their occupancy. On May 21st, you will see restaurants and bars allowing dining room service to return. Some things that you may see: empty tabletops, no condiments, no table tents, things like that. You may see barriers between tables, if needed, to ensure that 6-foot dining experience. Open doors and windows might be there to promote ventilation. You may see some wait staff wearing gloves and some not. It is not a requirement in case you do not see that. Sectors that are remaining closed, although a few things that will be announced very soon: K through 12 schools and childcare, adult services and senior centers, entertainment and recreation, including but not limited to theaters, recreation centers, festivals, theme parks, gambling facilities, concert venues, playgrounds, swimming pools, unless it's in your own backyard at your home. Also fitness centers, residential, and day camps and campgrounds. With each reopening phase, very specific protocols and procedures have been established for businesses to follow to ensure public safety. There are 5 key safe business practices that are being implemented for the safety and health of employees and customers alike. As an employee and patron, you should see these things happening. As an employer, you should make sure these things are happening. Number 1, face coverings. Face coverings are required for employees while they are at work. There are some exceptions to that, and they are listed in the Stay Safe Ohio order issued by the governor. An example is if you are in an office setting and have your own office with door or very tall cubicle walls between you and the person next to you. While you're at your desk, you do not have to wear that mask. But if you're back in common areas where other people are, you do need to put that on. Face coverings, while not required, are recommended for customers and patrons. It is at the discretion of the business if they would like the usage of face coverings to be mandatory by customers in their establishment. And some retail establishments are requiring that customers wear masks while in their store. And that should be clearly marked at the front of the store when you go in. Homemade masks are acceptable and should fit tight to your face. To be effective, you need to wear the mask over your nose, mouth, and chin. The reason for covering is to protect those around you. There are some very fancy masks out there. Some go over your ears, some go over your entire head. If you wear a mask into the store or to work for a considerable amount of time, wash a fabric mask with your regular laundry. Number 2, conduct healthy health assessments, daily health assessments. Employees must perform a daily symptom assessment, which includes answering questions on their well-being and if they are experiencing any symptoms. A temperature check, either by the employee before they come to work or the employer at work, must be done and tracked. If an employee reports a fever of 100.4 or higher, or shows signs of other symptoms, a dry cough, shortness of breath, etc., they should be encouraged to stay home until they are free of fever without the use of medication for at least 3 full days, and symptoms have improved for at least 72 hours, and at least 7 days have passed between their first symptom began. Number 3, maintain good hygiene at all times. Employers and employees are required to perform regular hand washing and maintaining social distancing. Customers are encouraged to use hand sanitizer frequently while in an establishment. Hand sanitizer stations should be placed in high contact locations. Number 4, clean and sanitize. Clean and sanitize all workplaces and in your establishments. Must be clean and sanitized throughout the workday and at the close of each business day or between shifts. If you are an employee, clean your desk, clean your workstation, doorknobs, high-touch surfaces often. Cleaning supplies should be given to you by your employer. Hand sanitizer stations should be placed in high contact locations for employees also. Number 5, limit capacity to meet social distancing. Capacity should be at a maximum of 50% of fire code. Post social distancing signage, floor decals, that type of thing. Make sure it's very clear what you are asking patrons to do with your signage. These are examples of signs that make sense. You can see what 6 feet looks like in the bottom picture. And on the top picture, I know to wait in the circle, or on the picture on the right, the ones with the feet, I know to stand there. These are examples of maybe a little bit of confusing signage. I know the one on the left is even just hard to actually see. And the one on the bottom on the right-hand side, I'm not exactly sure who measured that, but I don't think that's 6 feet apart. The stay-at-home order has been renamed the Stay Safe Ohio Order and is in effect until midnight, May 29th. Some things included that remain the same. The elderly and those considered vulnerable are urged to stay in their residence to the extent possible. Gatherings of 10 or fewer people only, and social distancing. Neither weddings nor funerals are prohibited, but are subject to 10-person limitation. As before, the order does not apply to religious facilities, entities, groups, or their gatherings. Tests and testing capability have been a struggle since the beginning of the pandemic. Here in Ohio, though, the testing capacity has begun to ramp up recently, and it is estimated that approximately 22,000 tests a day could be performed by the end of the month. There are 5 priority levels to which tests will be administered, with a focus on levels 1 through 3 currently, which include persons who are hospitalized, healthcare workers, residents in congregate living settings, which are senior living facilities and prisons, first responders, and persons having surgeries. As more testing becomes available, priority can be extended then to the other 2 levels. The next few weeks will be key in determining how the summer might go. If we are successful in keeping new cases under control and a large spike doesn't occur, we may see kids go to summer camps, maybe even an outdoor event in the evening. I recently read a draft of the Reset and Restart Education Planning Guide, which is a starting point of what K through 12 could look like in August. There could be staggered school days with kids in school a few days and then remote working a few days. We just don't know what the summer holds, but we are making progress. One thing is for sure, COVID-19 has turned some of us into epidemiologists, supply chain experts, and in the last few days, oil analysts. We have seen new innovations happening before our eyes. Machines that disinfect large amounts of masks are being used more than once. Distilleries making hand sanitizer and auto manufacturers making ventilators. This disease that we cannot physically see in the air has changed the way we live, the way we work, and the way we interact. Who knows? We may revert to old habits in the next few weeks, months, or years ahead. Hopefully not. A lot of people took this time to find a new hobby, finish a project, remodel, or even take some time for self-discovery. For me, I noticed something that hasn't changed, and that's our resilience and empathy for one another. In times of crisis, our society always steps up and lends a hand to those in need. The pandemic has been no different. We may not know what tomorrow brings, but we do know that we're all in this together. Thank you.